So you've probably seen the headlines where there's record waiting times in the NHS. The NHS is in crisis and thousands of people cannot get appointments seeing their GPs. But what if I told you that thousands of doctors are now delivering Amazon packages or driving Uber because they just cannot get jobs working as a doctor or a GP? Hi, my name is Dr.ErmaDerma and I'm a dermatology resident doctor working in the NHS, and I also coach and mentor other doctors to get into a specialty training. And honestly, this is the worst I ever seen it. But how did we get there? Let's dive in. So this is how bad the situation is. Around 33,000 doctors applied for 12,000 specialty training posts according to health education statistics, which means 20,000 doctors would be left unemployed, and that means they won't be consultants or GPs. Now, this is a problem since when medical students graduate and they either want to become a GP or a consultant or any other specialty, then they need to go through a training route. And what people don't understand, or the public don't understand, that this is not an automatic process. They need to jump through hoops. They need to reapply and re-interview again to get to become a consultant or a GP. So, for example, if someone wants to be a dermatology consultant, they need to obviously graduate from medical school, then they get into foundation year training, and then they need to do core medical training. And for that, you need to reapply and re-interview again. And once you finish your core medical training, which is usually 2 to 3 years, and you need to reapply and re-interview again to get into dermatology training. And this is the same for other surgical routes. However, for other specialties like GP, ophthalmology, or radiology, you just need to do foundation year training. However, you need to reapply and re-interview again to get into that run-through training to become a consultant or a GP, which those specialties are also very super competitive. So as you can see, it's not an automatic process where you just become a medical student and then you're just on track to become a consultant or a GP. There is competition in each of those processes. And unfortunately, the competition ratio has been increasing. So when I applied for core medical training, which was a long time ago, I'm very old, which was around 2017, I think, the competition ratio was 1.4 to 1. Now the competition ratio is 4 to 1. And I also noted that psychiatry is also very competitive. In 2017, when I was applying for my core medical training, the competition ratio for psychiatry was around 1.26 to 1. Now the competition ratio is 10 to 1. That's 10 times worse, i.e. 10 times super competitive. But it's not only resident doctors or junior doctors that are suffering through unemployment, it's also GPs. And according to the BMA report for GPs, around 56 of GPs wanted to work more hours, but they just couldn't find more GP work to do this. And around 15% of GPs just cannot find work at all and essentially are jobless. And unfortunately, 70% of these GPs have reported stress and anxiety because they just cannot find work and they are facing financial hardship. And there are multiple reasons why doctors are getting unemployed. One reason is the bottleneck, i.e. the lack of specialty training jobs. And to make sense of this bottleneck, we need to go back to COVID. So in 2021 to 2023, the government had increased medical school places and medical school admissions. So according to the GMC report, in 2023, the number of medical students that actually got admission into medical school was around 10,000, which was greater than the pre-pandemic levels in 2019. Now, people may think like, oh, this is a great thing because more doctors are seeing more patients. And obviously in COVID, we needed more doctors to see sick patients. Unfortunately, when those medical students graduated and wanted to apply for specialty jobs or get into core training, those jobs did not increase at all, which unfortunately caused this bottleneck, which means more competition because there has been a lot more medical students that graduated to become doctors are now fighting for these tiny amount of specialty training posts, which has not increased to accommodate this large influx of medical students graduating. And unfortunately, this bottleneck is just getting narrower and narrower and narrower. However, it's not only doctors that are competing for these specialty training jobs, it's also other healthcare professionals that they're up against. So this leads me to the physician associates and advanced nurse practitioners. So what are physician associates? Essentially, physician associates are healthcare professionals that did a degree in science or any other degree, then they did a 2-year type of internship in the NHS, and then they become a physician associate. With advanced nurse practitioners, they have trained to be a nurse and they go through qualifications and training to become an advanced role in a particular specialty. And I'm so sorry if you are a physician associate or advanced nurse practitioner that is watching this video. I may have simplified your training process, but if you want to comment below on exactly what the training involves, please do. This is just for the sake of the video. So I'm not denying that both of these specialties are crucial for the NHS because they are helping decrease waiting lists and also helping decrease workload from the NHS doctors. But unfortunately, this is taking up space from the training of junior doctors that traditionally junior doctors did. So the structure for a physician associate or advanced nurse practitioner is that there's a lead consultant that usually supervises the physician associate and advanced nurse practitioners whenever they see patients or do procedures. So now this used to be where the junior doctors used to take those roles and the consultants usually train them and lead them, and this is how junior doctors got their training. But unfortunately, the system in NHS is where the physician associates are now taking space from those junior doctors and AMPs as well. And it's not only junior doctors that they are taking up space from. This has also been happening in GP clinics. So there has been physician associates, advanced nurse practitioners, and I've even seen some paramedics are now seeing patients in GP clinic. And they usually have a lead GP that usually supervises all of them. Traditionally, there used to be a lot more GPs that usually only seen patients and made practical management plan. But now there's physician associates, AMPs, and sometimes paramedics, and a lead GP that usually supervises them, which is unfortunately cutting jobs for GPs to work in GP surgery. Now, this is due to multiple reasons. The response for this was to, decrease NHS waiting times and also help with the workload for doctors. Now, the rise in AMP, PAs, or any other healthcare professionals doing a traditional doctor job is due to multiple reasons. The government likes this because they are relatively cheaper to train than a resident doctor. Apparently, it takes £230,000 to train up a junior doctor, as well as if you have PAs or AMPs working in a GP practice, their salary is significantly less than a GP, which is essentially cutting costs and saving money for the NHS. And I don't think this is going to stop. So according to the NHS long-term workforce plan, by 2031 and 2032, they want more nurses to apply for AMP positions and want to increase this by 6,300 per year. For physician associates, by 2031 and 2032, they want at least 10,000 PAs, which unfortunately causes a lack of specialty jobs for doctors and for GPs. But it's not only AMPs and PAs that doctors are competing against. They're also competing against the rest of the world. So in 2019, a policy had been changed where international medical graduate had the same chance in applying for specialty training job as a UK graduate. Now, these statistics are not based on nationality or ethnicity. International medical graduates are purely people who had graduated from medical school from a different country and not in the UK. So why is this a problem for UK graduates? So if we look at the statistics from the GMC Workforce Report, in 2019, there were around 90,000 international medical graduates who had license of working as a doctor. UK graduates were around 169,000. Compare that to 2023, UK graduates were around 185,000, which had been an increase of around 9%. For international medical graduates, this had increased to around 130,000, which is around 41% increase. And of course, because of this large increase of international medical graduates having a license of working as a doctor in the UK, they would of course apply for specialty training. So if we look at the health education statistics of amount of international medical graduate applying for specialty training jobs, there are certain specialties that international medical graduate have been applying more than the UK graduate. So if you look at the GP specialty, there have been around 10,000 IMGs applying applying for a GP specialty training post, compared to UK graduate, which is around 4,000. This is also the case in psychiatry, where around 2,500 have been applying for a psychiatry post compared to UK graduate, which is around 900. Which can be why psychiatry had increased 10 times from when I applied. And looking at the health education website, there have actually been more IMG doctors getting into GP training posts compared to a UK graduate. So why is this a problem for a UK graduate? Since this is actually increasing the competition ratio for them applying into specialties and essentially getting a job. But this is also a problem for international medical graduate, because if international medical graduate actually do get into specialty training post, there may be no certainty that international medical graduate would even get a job, even if they did complete their training. For example, since there's more international medical graduate actually getting to GP training, but we know that unfortunately GPs are unable to get a job once they do qualify. There is more GP unemployment now. And this is a problem for international medical graduate, because I understand that they are paying thousands for their visas, thousands for the PLAB exam to actually work in the UK, and thousands for relocating. So I really do heavily advise, if there are any international medical graduates watching this video, to get a mentor and to speak with someone who have actually gone through the process in the NHS to see if it's actually worth your time, energy and finances to come here to work as a doctor. And if you can't find a mentor for that, I do have a coaching agency where you can just look at the link below and just see your designated coach for that. So you must be thinking that, of course, there must be non-training roles that doctors can apply to in the meantime whilst they get into their training role. So yes, there are clinical fellow jobs where doctors can apply for those if they don't get into specialty training. But unfortunately, these are also getting competitive, since there are more and more doctors which are getting unemployed and unfortunately can't get into a specialty training jobs, and therefore they apply for all these clinical fellow jobs. And unfortunately, these are getting so much more competitive. So is the government actually going to tackle these issues? And has the BMA actually said anything? So the BMA is the British Medical Association, which is basically our doctors' union. What the BMA proposed essentially is to go back to the 2019 system, where UK graduates had priority into applying for specialty training posts, and hopefully this would decrease the competition ratio. But of course, the BMA is just a union, and it's actually the government that would make those policies and plans in action. So the government would want to look at the cost benefit analysis, i.e. is it cheaper to train international medical graduate compared to a UK graduate working in the UK? But also they want to see what would make them favourable for the voters. So I know immigration is a big thing in the UK, and they may twist this to show that, oh, we have decreased immigration or something. So it really depends on the government to see if it benefits them and cost-wise as well for the NHS, which is quite cynical. But I would love to know your insights on how this can be improved and what you generally think about this, and if I've missed anything out on why doctors are getting unemployed. Would love to know and would love to read your insights. However, if you are a doctor facing unemployment and stiff competition ratio, what does that mean for you? Because if these changes do go ahead in the future, that doesn't really change your situation right now. And this is why I started doctor specialty coaching, because I understand that unfortunately the job market for doctors have gone absolutely crazy. Competition ratios are through the roof, and you need to get your CV portfolio up to date, and also you need to score 100% in your interview. So if you are facing uncertainty, or you need help with your portfolio CV or interview practice, you can always check the link below in the description box and just select your mentor, and we will get you to your job and your specialty career. And honestly, you can be coached about anything. So don't worry, just email us if you don't have the desired specialty, and we will hook a mentor up for you. And if you have been rejected for an interview, whether that's for special training or clinical fellow job, I've actually done a video for this on how to deal with that rejection. Thank you. Bye.